Hello everyone. Good evening. Some more time to evening. I'm sure we had a very good lunch. And you know, Renu, after lunch sessions are difficult.
So I hope people are all back in the form and not feeling lazy after the lunch session.
Okay. The topic given to us is a very, very interesting topic, something that's close to my heart for sure. On how do we actually select different skin modalities. Now when we say skin modalities, it's all the different skin machines that we use to really treat the skin. Okay? So today we decided to do this in a different way. You know, we could have done a traditional PPT also.
Yeah.
But me and Renu felt, let's get our live experiences on. Yeah? So before we go on to the modalities, I would want to really start off with a small prelude to the topic, where I would say introduction to a topic. Now, before we select a machine, it's very, very important and critical that we analyze the skin properly. Now, most of us in the salon setups, we actually skip this important step and make it the most shortest step possible. Agree? Do we agree to that? We make it the shortest step because we always feel that the client actually is not going to pay me for the analysis, going to pay me for the treatment there. But I would say with an experience in this field for more than 20 years now, that analysis becomes the most critical point on which you can actually treat the skin of a client. So typically, what do you do in an analysis? You know, you can do analysis in many ways. The most modern would be, you know, using a machine and actually going around and looking at the images and the pictures. You have the VisioFace machine available now. It's from Germany, which you can use. The person puts the head there and you get the whole picture there. A lot of modern tools. But many salon owners come back and say, but that's not viable to us. That's not practical for us to really have such machines come in. Because it's expensive and we can't charge our client for it. So I would say in analysis, just go by simple things which you need to do. One is the questioning to your clients. You know, questioning them. So we would question them for sure. We'll ask them, which is one of the biggest blunder which we all do. We'll ask them, ma'am, what's your skin type? Sometimes we do that. नहीं मैम आपका स्किन कैसा है? No, rather, how does your skin feel after wash? How does your skin feel when you get up? Very, very critical pointers to us. Okay? Somebody says oily लगता है after getting up does not mean it's always an oily skin. It could be an healthy skin also. Okay. Do we ask them about their lifestyle? You know, I had student who would say, ask the question, Madam, आपका lifestyle कैसा है? I'm sorry, client is not trained for question answers. We are supposed to tune our questions in. So, when we say lifestyle, we want to know where do they stay the most. Till so many years, the question was related only to the sun. आप धूप में रहते हैं क्या? Now I would rather want to ask is, आप AC में कितना time रहते हो? Because that is where the quality of your skin will completely change. And I'm sure all of us would have realized this. आप स्क्रीन पे कितना टाइम स्पेंड करते हो? इम्पॉर्टेंट, नॉट इम्पॉर्टेंट? वेरी इंपॉर्टेंट. कोविड हैज टॉट अस दैट कि हम स्क्रीन पे इतना रह रहे कि हमारी स्किन हमने बैड कर दी है. ओके, द ब्लू लाइट इज ऑल्सो किलिंग आवर स्किन देयर. नाउ यू गो टू आस्क हर अबाउट हर फूड हैबिट्स. यू आस्क हर अबाउट हर. Okay, all of us are very nice in asking about the water which we drink. Instead, I would go one step and ask them, do you drink a lot of juices? Do you drink a lot of aerated drinks? Do you have a lot of tea and coffee? Not only water. I would want to know what lifestyle is, how I will pick on this. After this is my client questioning. After this, I'll go to the next step. This doesn't take time. It just takes 2 minutes. Go to the next step where we would actually analyze the client's skin. Now, when you analyze, it's very good to use a magnifier lamp. I'm sure Renu will agree on this.
Yes.
Because it's a trick it's also a trick, but it's also the client loves it when you see something under the light. but that's very important to us.
And also very professional.
It looks very professional.
Yes.
Yeah. So you typically look through the light, and what do you look for? We look, but what do we look for? So I look for things like fine lines.
Yes.
I look for things like the pigmentation. Is it superficial or is it looking deeper?
Dehydration.
Okay. Dehydration I would look for. I look for those visible things, and then I also would do the touch test on her. But पूछना पड़ेगा, client को permission लेके करना पड़ेगा. So what is the touch test that I would do with them? We would understand the muscle tone of the client. Is the muscle tone good, bad?
Yeah.
Circulation of the client. Is the circulation good or bad? A very good way of knowing your circulation is on your forehead, just press and just see the time when the white patch disappears and the red comes back. Another way to do your muscle test or a collagen test is the thumb test. When I press the thumb and I release it, I want to see what time does it take to bounce back. That's how I would test the collagen of the client. These are the parameters which I should test for every client. And then I make a treatment plan. So when you make a treatment plan out like that, you're actually working towards treating the client's skin to make it better and better. With every visit she comes to you. Not just the glow. Glow will come, but it's also making her skin go better. Okay? So now Renu is going to tell me some of the popular treatments that any salon would do, or popular machines the salon would do. Yes.
See, today every brand what we use, lot of brands, the products are very good, very nice, but a lot of brands tell us that the products will show you results without the machines also. So it's okay if you don't use the machines, the product itself are very good, and yes, they are good. Even if the machines are not used, the product shows results. But I always feel the machines enhances the results of the products what we are using, and the client feels that the treatment is not complete if we don't use the machine. Once the machine we used, yes, like we use the vaporization machine, which is like also for giving steam, opening pores, cleaning, taking out comedons. Client feels that the treatment what we are doing, is proper, no doubt we can do all these things without the machines also, but our Indian client feels satisfied and complete only when the machines are used. So we use a lot of machines in our salon industry. We don't use a very, very advanced machines, but I think a lot of salons use high frequency machines. They use ultrasound, they use galvanic, they use sonic pillars, and nowadays a lot of salons are also using hydrofacial machines. So these are different machines to be used for different treatments. So every machine has different usage which they use according to the treatments which the clients require.
Thanks. So would you want to tell us a little more on which machine do you think we would use on a particular skin condition?
For acne and all, we can use high frequency machines. We can give them direct high frequency, so it helps for acne, and indirect way it helps to penetration, and also for aging skin. You can also use ultrasound for aging skin. So for fine lines, penetration of serums, penetration of products is better in ultrasound. You can use brushing units for deep exfoliation, but you can also use sonic pillar where the abrasiveness is less. Also, penetration of serums is better. So, different machines are used for different things. Advanced machines, I think Vaishali knows better what advanced machines can be used in salons, but I think these are the basic machines what every salon uses it in their salons.
Thanks, Renu. So, generally, when I meet a lot of beauticians, they all come back and say, but these are very basic machines.
Yeah.
ये तो बहुत पुराना है. But trust me, these are few of the machines which actually gives you results even with the basic training which you have got.
Yes.
Okay. Now every machine which you use you need to be trained hand. With an untrained hand, we could give you a beautiful machine, but nothing is going to give you a result because you're not a trained hand there. So these are basics which you could use. As she rightly said, yesterday we were having a competition and we had a lot of people come and talk to us and ask us, मैडम बट ये तो रॉड ने उसने फेस पे भी नहीं लगाया है, तो मशीन कहाँ से काम करेगा?
करंट से काम करेगा.
करंट कहाँ से लगेगा? So then we said, but this is indirect high frequency.
Yes.
तो saying वो क्या होता है? हम तो बेसिक मशीन की बात कर रहे हैं जो बहुत सालों से चल रहा है. And as she rightly said that we use a indirect high frequency for a mature skin. Okay, we use it for an aged skin, a dry skin, an oil dry skin. Very, very effective. And most important, it gives you a nice sedative effect also. Your client will definitely go off to sleep. Yes, they do go off to sleep.
And he will feel very rejuvenated after he finishes.
Yes, it's a beautiful machine, and one of the successes after that, they'll use a restroom because you've done a beautiful lymphatic drainage at that point of time. Some other machines like the galvanic machine. Again, most of the salons, I'm sure you will all agree on, has replaced the galvanic machine with an ultrasonic. How many of us have done that? Okay, because we were told that they are interchangeable.
Yes.
But let me tell you, this is an experience and you can go home and try this machine if you still have the unit with you. A galvanic machine creates a chemical change below your skin. Ultrasonic machine only has the waves below your skin, does not create a chemical change. That means if I have a skin which is a very, very oily skin, I want my client's skin to start getting normal. My galvanic works on that. After 4 to 6 weeks, you can do it once a week also, only galvanic. Don't do all the machine and the jazz, only galvanic. If you do a weekly treatment with them, in 4 to 6 weeks, आपकी client की skin will start getting normal. Take it from me. Try it. And because we stay in India where our water is ionized, even your plain, don't tell this to the product brand, they'll kill me for this. But if I don't have a product which is right, I could also use the tap water there. Only for the treatment part. I'll have to do everything before and after. Only the treatment part. Ideally, I need to have ions. But our water in India is ionized. We already have charged ions in our water. Okay? So what we would do is we actually use an aloe vera gel which is diluted with water and then you use it on the client. Yeah? Similarly, you might have a lot of clients who come to you with a dehydrated skin. They're beautiful oily skin but it's dehydrated. And how do you know this, that they're dehydrated? You start seeing fine lines coming. It's not a beautiful natural glow. It is a product glow which is coming there. The moisturizer glow which is coming. Again, in this case, use a beautiful serum with a galvanic positive and see the result. Now, these results are longer. I'm not saying ultrasonic is bad. It's good, but not for all skin types, not for all skin conditions. Use this and see the result. Okay? So this could be a basic machine, but trust me, it's beautiful results. You know what? Another thing which we do, and I've really seen the result. We all Indians have cellulite.
Yeah.
Okay, we all have cellulite, even if you're thin or fat. And to treat cellulite, there are very expensive machines that come.
Yes.
Like there's an endomorph machine. There are a lot of machines that come in. And they would cost in Indian rupees about 10 lakh rupees, and we don't want to spend that money. We are okay to live with cellulite.
Yeah.
So you use a galvanic. There's a body galvanic available on the body. And trust me, you will start seeing your cellulite going away. It's just a treatment of 8 to 12 sessions. That means 3 months mein cellulite is going away. Your skin appearance starts getting better. That's the power of this basic machine. Talking about the advanced machines that we would use, the most popular one definitely is the LED ones. LED, safest. How many of us use an LED?
How many of y'all use LED lights?
We all? Yeah.
LED mask.
LED mask or an LED light or a cover.
Yeah. So nowadays, like they say, the light gives you different sort of results.
Yes.
So like the red light. What does red light give you? Anybody can answer? So red light is a very popular light of LED which gives you rejuvenation, glow, radiance, and it is normally used for all of these things. And another popular light is blue light. It repairs your skin. So this is the normal LED lights, LED mask you get with these lights which are used on skin to repair, to rejuvenate, to treat skins. So this is now what people are using in salons. Most of them are started using this. Very safe to use.
Very safe to use. Very little precautions to be taken. You know, like if I'm doing an LED, I just want the client to close her eyes.
Yes, or put some iPads on that.
Don't open it up there.
Put iPads.
Put iPads there. Now you're treating these young girls and boys. Now our salon has started getting younger people. You don't want to, they'll get scared doing a high frequency on them.
Yes.
Now they have acne and you want their acne not to spread. A blue LED works fantastic for them.
Also repairs your skin a lot.
Yeah, it actually kills the bacteria and actually gives your skin and doesn't allow the acne to spread.
Yeah.
So you could be using this light, and it's one of the most inexpensive treatment to be done, frankly. Okay, so there are people who definitely do. So I've seen also rather, people on a regular light would put a blue cellophane paper or a red cellophane paper.
That does not work.
That doesn't work. We really require those special lights, and then it goes there. So this is the most popular. Another most popular, I'm sure, which you really like it, is the Hydro.
I feel it's Hydrofacial is something like every person is talking about. Every person wants to know about. Every client comes and requests, do you have Hydrofacial machines? So anybody using Hydrofacials here? So it's you're using. Okay. So it's very important because hydration is the first level which a skin should have to have a glow on your face. You know, hydration is very important. We tell people to have water to increase hydration, everything. So Hydrofacial has become very the in thing you say to us in the salon line today. So what does Hydrofacial machine does? It with vacuum it gives abrasion, and from abrasion you penetrate water into your skin along with serum. So the serum and water is penetrated. With abrasion, the pores are loosened up, and at that time, infused water and serum is infused in the skin, and with that, hydration is developed. I mean, the skin gets more hydrated, feel more hydrated, and once a month, if you do that services, you can actually see the glow on your face because water retains in it, and water creates a lot of. That's the most important thing for skin health. So once skin is healthy, there is always going to be a natural glow on your face.
Yeah. So, yes.
Yes. Okay.
It's the same thing.
Now, yes. Correct. So, but see, so it's the new way of talking the same machine. Right.
So coming to that very nice point which she raised in, do you know Hydrofacial is a modification of which machine? The Microdermabrasion is a modification of which machine? Vacuum suction. And now if you ask people that I use a vacuum suction, they say you're an old school person.
Yeah.
But it's a newer version. It's easier to use. Yeah. So what did vacuum suction do to us? Vacuum suction is a beautiful machine which helped in lymphatic drainage. It helped in opening and clearing your pores.
Yes.
And it gave you very, very good results. Okay. If you had a puffy face, vacuum will do the trick. Yeah. Similarly, you go to the next machine which is Microdermabrasion. Again, your lines which you use, the direction of usage is the same as vacuum suction.
Yes.
You can't go you have to go in the direction.
Yeah.
You will still have a little different step, but directions are the same. What did Microdermabrasion do? Microdermabrasion. That means very small abrasion to your skin.
Yes.
Okay, what did it do? What does it do even today is actually removing the dead skin from, and the vacuum is helping in two things. Also your lymph drainage and picking up all the dead skins and pumping it back to your machine.
Yes.
Okay. It does use aluminum crystals, which are the safest ones. It does not cause any reaction. However, if you are sensitive skin, if you're thin skin, not recommended to
Yes, you cannot use it.
Okay. It will start getting you rashes. It will get you scratches. What is the next machine that came was diamond microdermabrasion. The diamond machine. So what did that do? Same. Vacuum was the first base. Used strokes.
Yes.
And there was a diamond tip there, which used to do the abrasion. But these were all mechanical abrasions.
Yes.
Now our skin is getting more and more and more sensitive. So what did we do next? Kuch to naya chahiye na? So we came to Hydra machine. What does Hydra machine do? Same thing, vacuum, and you have water that comes in force, but there is two mechanisms. There's water which comes with force,
Infusing the skin.
which first abrades the skin. So it will do your work of removing the dead cells, and the serum which comes in your skin will go in the skin.
Yeah,
So it did 2 and 1, infuses. It did 2 and 1 steps. So this is how evolution came through in our own same simple machine. So if somebody learned a simple machine years back, today you will be a master in using these machines. Yes? So these are few machines that we would use. Now the newer one coming on our block
Now
is...
Vaishali is going to tell us what advanced machines we can use in
Yes.
this.
So we're going to talk about electroporation. Anybody knows electroporation? We've heard about it? Yes, no.
Yes.
No. Suna hai electroporation? You know what it does? You've heard? Yes. You know what it does? Infusion
It's
of
a way
the
to-
product in there.
Yes.
But how does it do it? Without any pain, okay?
So, चालू है? So it is based on the ions, the electricity in the body, the negative ions and the positive ions. It comes in two variants: the cold one, and another one is the hot one. Electroporation, which makes use of electricity.
Okay. Little there, little there. But it's okay. Good attempt there. Yes.
It's almost like galvanic, you can say.
Okay. So I'll give you a little good there. So the way it is sold is it is 400 times more effective than galvanic. That's how it is sold. Now what does electroporation do, or what it is also called is called as no needle mesotherapy. No needle means there are no needles which are going to be used, but it works like a derma roller. Okay, what a machine will do, it will create a lot of micro channels in your skin. It will create a lot of micro channels, because of which the product penetration is very, very superior. So electroporation machine actually creates this channel without any pain. There is no pain. So there is no needle which needs to do that. Okay, so that's the benefit of the machine. So, but again, it has to be a water-based product that has to be used. Okay, now coming to this is leading to another one, which is the derma rollers. Do we use derma rollers? One, yeah, interesting one. Derma roller is one of the cheapest modern modality to use. But now what is derma rollers? Again, it is rolling on your skin. I wouldn't prefer a roller, I would prefer a stamp. I'll tell you why. Because when my needle goes inside and I roll, my needle comes out in a different angle. It is sometimes damaging my skin. Rather, if it's a stamp, it goes in straight, comes out straight, goes in straight and comes out straight. So a derma roller or a derma stamp is one instrument which can create 72 to 108, 110 holes at a time in your skin patch, and goes on creating that. And when you use a product with it, the product penetration is very good. But only thing which we should really take in mind is, do not use a regular product with it, because you are putting it in the skin through a needle. So you must use a product which is very, very sterile product.
Okay.
Very, very sterile product. So there are special products which are available for that. And I'll tell you one learning which I got when I went to Sweden for a seminar like this. Acne treatments, we say acne skin, do not do a derma rollers. I had a doctor there, and a very, very experienced doctor, and he had actually done a treatment on n number of clients, acne clients, and cystic acne also. He had done that using derma rollers. A proper doctor, I mean a qualified MD, not just a regular doctor. And he said it's a very, very logical thing. Acne grows in an anaerobic atmosphere. It's inside, no, grows inside, जहाँ पे हवा नहीं जाती. The minute I puncture it, हवा चली जाती है, atmosphere becomes anaerobic. एयर चला गया, वो हो गया, तो एक्ने मर जाता है. एक्ने के जर्म्स, पी एक्नेस बैक्टीरिया मर जाता है. And then that acne will not spread. But he said, important is the clients, I mean the beauticians, in his terms, they don't realize that the product which you use needs to be sterile. हम प्रोडक्ट कोई भी सीरम उठा के डाल देंगे तो नहीं चलेगा, आपको वहाँ पे rather इन्फेक्शन हो जाता है. So this is a beautiful tool to use, but use it with a sterile serums, works wonders. Okay, so this is one of the new things.
So what I'm saying, all these advanced treatments which we can do in salon, but we have to have specially trained
Yes.
therapists to do all of that.
You really raised a very good point there. I mean, I really agree too. And this therapist cannot be a YouTube therapist.
Education there is very important there.
Very important. Because, sahi gaya to very good. What if something goes wrong? You don't know how to handle at that point of time.
Yes.
So I would rather say, in this case, if you really want to succeed in a salon using advanced machines and using a lot of modalities, I'm sure if time permitted, we will have more lists. But if you want to really do that, it's important to have trained hands at that. And training does not mean I went in a seminar, I saw something and wow, I liked it and I bought a machine. Or, I'm sorry to all my machine manufacturers here, that training cannot be 2 hours. The training needs to be a proper 2-day, 3-day hands-on training where things should go wrong so that I know how to correct them. My trainer should tell me about the pros and cons of doing things.
And there should also be follow-up trainings on that. What happened once they are trained, they are on the floor, then they realize what mistakes they make and then they can come back and ask them how to correct it.
Yes.
That's how.
She was telling me one of the reasons most of the salons don't do advanced treatments is because they do not have trained manpower for this.
Yes.
So we know where we are sitting on a big opportunity now. Okay, get yourself trained and start these, and I'm sure it's a big success out there. Big success out there. Yeah. I think we should open some time to their questions before the next speaker is already there.
बेसिकली एडवांस ट्रीटमेंट के लिए कुछ प्रिकॉशंस भी लेना ज़रूरी है. जैसे किलोइडिक स्किन है, वो हर एक को मालूम नहीं होता कि हमारा स्किन किलोइडिक है. या डायबिटिक पेशेंट्स हैं, वो हर एक ने अपना डायबिटिक शुगर लेवल चेक नहीं किया होता है. उस टाइम पे बहुत बार प्रॉब्लम आ सकता है. तो यही रीज़न है कि हम जो ब्यूटिशियंस हैं वो इस चीज़ को हैंडल करने में थोड़ी सी झिझक महसूस करती है.
So she is given a very good clue. Diabetic patients are उनको नहीं पता होता कि मैं डायबिटिक हूँ. How will you come to know as a therapist? क्या ये मेरी क्लाइंट शायद डायबिटिक हो सकती है या शायद उसको कंसर्न हो सकता है? Any idea? There's one more, 1 minute.
We need to fill the consultation form.
Proper consultation is always
No,
important.
but
but there are
उसको
other
नहीं
points.
पता. उसको पता ही नहीं है वो डायबिटिक है.
When the healing process becomes very slow in the person,
Could be, but not all diabetics have a slow healing. Yes. Very, very nice answer I've got from the front, but we'll reserve her answer.
So there are some few telltale signs on your customer or a patient. For example, if they are overweight, if they have black patches on the underarms or on the behind of the neck, if they have excessive skin tags. So generally these patients are, diabetic in nature.
That's a very good visual check. If it's not diabetic, it's always a pre-diabetic. Yeah? Yeah. When we pass the mic in the front, this is learning for us. I mean, we can always go and try this. Yes.
Skin sensitivity.
Yes, skin sensitivity test. So what we would do is, before doing any machine, on her hand, one hand, you give her a cold, something cold, kuch nahi to stone de do.
Hot and cold stone.
Another hand, you give a hot stone. Don't tell her what you're giving her. And ask her, how does she feel? Does she feel it different? So that's your temperature sensitivity which you come to know. Another is pricking her.
Yeah.
Don't
She
prick
feels
her
the
with the
sensation on
metal at all. Prick her with an orange stick. When you prick her on the hand or the cheek or the leg, especially the leg, you will make out
Feet, yeah.
feet. If you just prick her at a different point and see what is the intensity of the prick which she's feeling or not feeling, prick her with an earbud and ask her if there is a difference in both the pricks. That will tell you if the person is a diabetic or no, because in diabetes, one of the sign is loss of sensitivity. And in machine, it's not dangerous to use a machine for a diabetic. It's risky because of their skin sensitivity which is altered. You know, like suppose example, you're using a machine and you'll ask her, Madam, आपको feel हो रहा है? She'll say नहीं हो रहा है. So you'll increase. Feel हो रहा है? नहीं हो रहा है. Increase. Because she lost her sensitivity and you'll burn her skin. Okay, so it's important. You can do it with all clients. उसको special feel मत कराओ. Do it with all. And it will really help you to know if your client has any sensitivity issues or no. Yeah? Okay, so good point. Thank you for raising the diabetes, because I'm sure there's a lot to this information which can't come in. Any other question do we have? She has a question.
Machine, is that okay if I can ask?
Yeah, sure.
So, as Renu ma'am, in your introduction, she mentioned, in your introduction just now, that the girl mentioned employee attrition at least. That is how you manage.
Employee attrition.
At least, yeah. So I just wanted to understand, like managing a chain of salons, how do you actually manage that?
Take care of them.
I can tell you from experience of going to her salons, her staff is gaga over her. And they're like, she knows her team so well and the team knows her so well.
See, I always believe if you take care of your team, the team will always be with you. You have to understand them, their difficulties, their problems. Treat them like one of all. I mean, if the team is, you can't do anything yourself. If the team is with you, then only you're going to be rising up. So they are the part and parcel of you growing up.
When it is 1 or 2 salons, it is actually, when it is 2 to 3 salons, you have a smaller team. I do understand it is easy to take care of them, but when you go to the chain of salon, isn't that challenging for you to taking care of?
No, today we are 30 salons plus, spread over Mumbai, Pune, Hyderabad, Chennai, Bangalore, everywhere. But I think till today, I have been able to maintain connect with my team. I am accessible to my team even if they are at the lowest grade in case of any issues. Yes, hierarchy is there. There are people at different places, different stages, different positions where they can reach out to, but still I am always accessible to anyone at any point of time. So there are a lot of times where staff goes away or staff feel let down in hierarchy when their problems are not understood. So when you are approachable, and they feel that even with my little of the problems, I can still approach the heads. So I think they have the confidence in the brand, in the team, and I think my team down the line, even the heads and the position, know what I want in my head. So if I tell them that this is how I look at my team and this is how they have to also look downwards according to that. My vision is their vision. Understood? I think that is what I always believe in.
There's a question there.
मैम इलेक्ट्रोपोरेशन और आरएफ दोनों हम एक साथ यूज़ कर सकते हैं?
एक के बाद एक।
हाँ।
आपका काम दोनों सिमिलर करेंगे, कौन से रीज़न के लिए यूज़ कर रहे हो वो देख लीजिए। अगर आप दोनों को प्रोडक्ट पेनिट्रेशन के लिए ही खाली यूज़ कर रहे हो, पर आपको स्किन में कोई केमिकल चेंज या कुछ भी नहीं चाहिए, तो दोनों सेम काम करेंगे।
तो अगर हम यूज़ कर रहे क्लाइंट के स्किन के अकॉर्डिंग, तो हम पहले कौन सा यूज़ करें, इलेक्ट्रो या आरएफ?
ओके, अगर आप दोनों यूज़ करना चाहते हो, इफ़ आई एम यूजिंग बोथ, दोनों करना है मुझे आज, तो मैं शायद डिसइंक्रस्टेशन करूँगी क्लाइंट की स्किन क्लीन करने के लिए। क्लीन हो गई उनकी स्किन, फिर मैंने कॉमेडॉन्स और वो सब निकाल दिए, ब्लैक हेड, वाइट हेड, एक्ने सब, आई मीन उसके अगर छोटे पस्टुल्स है सब निकाल दिए मैंने। उसके बाद आई कैन डू माई इलेक्ट्रोपोरेशन बिकॉज मेरी स्किन ऑलरेडी क्लीन है, एंड व्हेन आई देन डू एंड क्रिएट चैनल्स, मुझे इन्फेक्शन के रिस्क बहुत कम हो जाते हैं। बट तभी मैं खाली डिसइंक्रस्टेशन करूँगी, क्लीनिंग का काम करूँगी, मैं इसमें आयनाइजेशन या आयनटोफोरोसिस का काम नहीं करूँगी।
थैंक यू।
वेलकम।
मैम फेरेडिक में जो दो मशीन आए, पहले एक 2 नॉब वाला आता था कि जिससे अपन इंसर्शन एंड ओरिजिन पॉइंट में अपना बेली पॉइंट चूज करते थे, अभी पैडिंग वाला फेरेडिक आया है, तो विच वन इज़ बेटर?
पैडिंग इज़ बेटर कमर्शियल पॉइंट ऑफ व्यू।
ओके,
आपने क्लाइंट को पैडिंग कर दिया, शुरू कर दिया, एंड देन यू कैन गो।
but it's risky now.
No. So, Ferretic machine, if you ask me, it's the least risky machine because it's working on the muscle. आपके मसल को कॉन्ट्रैक्ट एंड एक्सरसाइज करवा रहा है। सो यू कैन ऑलवेज पुट ऑन अ लोअर इंटेंसिटी, बेरेबल इंटेंसिटी। आपको यू आर सीइंग द contractions in the muscle, it's fine, she is comfortable, go मतलब you don't leave the place, but you can always go finish your work and be in the same room. but अगर आप 2 प्रोब वाला करते हो तो आपको एक मसल ढूंढ के करना पड़ता है। it's more tedious for a therapist point of view, so padding is easier always. और another thing, padding में एक साथ आप 3 से 4 मसल पे काम कर पाओगे।
हाँ, लेकिन हाइजीन के हिसाब से भी
padding is safer.
Safer?
Safer.
Thank you.
Yes, any other questions? No questions? ये after lunch का effect. Okay, thank you very much. So
Thank you,
if
everybody.
have questions, we are around for sure. Thank you so
And
much.
thank you for coming for the show.
Yeah, and thank you for being a good audience to us. Thanks.
Thank you, Vaishali, Shah and Renu Kant for joining us. As a mark of our gratitude, we would like to present you with a memento and token gift from Dermalogica. So we invite Vaijanti Balchandra to present the memento to you.
Renu.